minutes to those partners who were unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is helpful to us and to partners for connection purposes. So I'm going to go ahead and take a moment and do that myself. All right, thanks to those of you who are getting your information into our chat. I appreciate that very much. Today's agenda includes an update from the Department of Early Learning and Care on the employment-related daycare program, an overview of Vision into Action, and breakout sessions. Speakers, we do ask that you turn your cameras on while presenting where able, as our partners appreciate seeing the person who's talking. Of course, we would like to invite all those that are willing, able, and comfortable to show your cameras as well. We would love to be in community with you, and seeing you makes that so much easier in this virtual space. So at this time, I would like to go ahead and hand it over to the Department of Early Learning and Care to give us an update.
Yes, and good afternoon, everyone. So my name is Jen Eras. I'm the lead child care policy analyst with the Child Care Assistance Program Office. And I'll be sharing my screen here in a little bit. Can I get like a thumbs up or nods if you can see it? There we go. Oh, perfect. Okay, wonderful. Thank you, guys. So the information that I'm covering today is actually the upcoming ERDC waitlist. This is something that we've used in our program historically, but we actually haven't had it implemented for quite some time. The last implementation we had of the waitlist was back in November 2017. But kind of leading up to that, over the last couple of years, and especially after the pandemic, we actually have made a lot of changes to our program. The program is working a lot better for families. Some of the changes that we made were starting back in 2011, we lowered our copays so that they could not exceed 7% of the family's household income. And we also started paying providers in advance for care rather than paying after the fact, which is how we had handled things previously. The copays, that was a really big deal. Oregon was actually one of the worst states in the nation when it came to subsidy copays. For families who were just under our initial income limit, which was the same as the eligibility income limit for the SNAP program, they were paying about 24% of their gross income toward their copay. And then we had a higher exit limit, and that actually pushed families up over 30% of their gross income was how their copay was calculated. So now the highest copay we have is, I want to say it's $130 for some of the larger households. Anyway, so we've made a lot of changes. And then earlier this year, in January, we expanded the program to cover non-working students. And so, yes, we are hoping for a name change because employment-related daycare doesn't quite encapsulate what the program does anymore. But we also switched our authorization to part-time and full-time hours, and we expanded medical leave and sleep hours for two-parent households. Just recently, this July, we made some really big changes with the protected 12-month eligibility. That basically means we stopped closing cases for most reasons. The biggest reason that we had for families losing eligibility was because they couldn't find a childcare provider. And with the current state of childcare in Oregon, how most counties are a childcare desert for infants and toddlers, and then our preschoolers aren't much better. It has been really hard for some families to find and connect to providers in enough time. So we stopped closing for not having a childcare provider connected. And then we also expanded our eligibility to basically incorporate the TANF jobs program into ours. So TANF families became categorically eligible for ERDC. Really excited about this coming spring. We'll also be expanding eligibility so that we'll cover children regardless of their immigration or citizenship status. So that's a really big change. That's something that Oregon decided to do. So we will be using general fund. We can't use our federal funding source for that. So it's been a little bit trickier to try and get the system changes in, but we have been working on that and we're really excited to see those expansions. As you can see, the program has changed a lot in the last couple of years. This graph goes a little more than 2 years back. So at the July 2021, that was just post-pandemic. The program was starting to recover a little bit. We did lose a lot of our families during the pandemic because of employment loss. And so about that time, the caseload, it was just right at that 8,500 mark. It didn't really like to go much higher or much lower. But then over the next year or so, the caseload actually hit 10,000 cases. So this last year, it hit 10,000 cases for the first time since I want to say it was 2010, I think was the last time that we had that many cases. And then here in January, that's when we increased the eligibility to allow for the non-working students. And then right at this mark here, this is where we changed the eligibility. So we stopped closing cases. And we were closing probably about 400 cases a month. So there were a lot of families that were losing eligibility. And then also the categorical TANF. So with our program, the budget's set every 2 years. We're not an entitlement-based program. And so if we run out of funding, we run out of funding. So the increased usage of the program is really great because we actually have a program that's working for families. So I do just want to stress that piece of it, that these are really exciting changes and it's making a childcare subsidy that's actually helping families in Oregon. So with that, since we do have limited funding, after November 3rd, we will implement the wait list. And this is simply because of increased demand. We've actually had caseload growth that we've never seen before. And like I said, families are really just coming in and asking for the benefits, where there were times when we would actually see the caseload drop without having a wait list implemented. So the way the waitlist will work is effective midnight on November 4th. That is when the system will flip over and the waitlist will be implemented. If someone submits an application through the one system as late as 11:59 p.m. on the 3rd, then they will not be subject to the waitlist at all. And based on the current budget that we have and the current caseload that we have, we don't anticipate being able to select families off of the wait list for the rest of this biennium. So that's a really important point to get across. The last time we had it implemented, we were making monthly selections, but we don't foresee that being the case this time around. Primarily, that's because with some of the eligibility changes, how we've increased stability of the program, we don't think that we'll be losing as many cases per month when the wait list is implemented. So waitlists are something that are pretty common throughout the federally funded programs. Last year, there were 12 states that either had a waitlist or they had a hard freeze to enrollment to their subsidy programs altogether. And like I said, Oregon has used waitlists in the past. I want to say it was between 2011 and about 2016. We had a waitlist implemented about 8 months out of every year. So it was really commonplace at that time. And just with changes to the program, changes to provider requirements, we actually saw less usage of the program up until more recently. So like I said, we had our changes to the 12-month eligibility that really helped to stabilize the program. And so we think that will impact the attrition rate, and the attrition rate is the number of cases that drop off the caseload each month. And then eventually, essentially, like we'll have the wait list implemented, and if there's space in the program, so if people have left the program, and depending on funding too, we'll be able to select families. They'll be selected based on a first in, first out. So those who submitted their application on midnight on November 4th, they will be the first ones to be selected and given a chance to apply. So to be added onto the wait list, we don't require families to be eligible for ERDC. They just have to, if they don't meet one of the exceptions to the wait list, they'll be added on. This is because family eligibility or family situations can change very quickly. So we didn't want to base the wait list off of if they were eligible at the time that they were applying. When families are selected, they'll have a 45-day period where they just have to contact us and say, hey, I want childcare. And that's what starts the application process for ERDC. And then at that time, they'll be able to reapply and be evaluated for the benefits. So I mentioned a little bit about some families who can bypass the wait list. So this is why we still want to encourage families to come in. They will be screened to see if they meet any of the bypasses. The first one is essentially, it's like a grace period for families who are reapplying for benefits. If they just miss the reapplication for some reason, they have up to 2 months to submit a reapplication for ERDC, and they will be able to bypass that wait list. We also will be able to bypass a wait list for families who are either receiving TANF or TADVS, which is our domestic violence grant, or families who had recently received it. So this is in the last 3 months. If they had been on TANF or had received or been eligible for that TADVS grant, then they can bypass as well. We do have a referral process that's built in for our partners at child welfare. So essentially, if there's a child who needs childcare as part of their safety plan, so the childcare would either be needed for them to remain at home, to be allowed to return home, or to be placed with a known adult, then we can get a referral form from the child welfare worker, and we have that form that's available on our form server. It has to be signed by them, but that allows that family to bypass the wait list as well. And then we do have some contracted childcare slots that, since they are contracted, we've already obligated the funding for those families would be able to bypass the wait list as well. And that's with Head Start and Early Head Start are where our contracts are. And I can pop the links for this in the chat, but also Misha, you'll get this copy to send out, but there's a link here for our partner toolkit, which is really great. It's got FAQs and talking points. It links to a bunch of different resources, including like communications that we've sent out and things like the press release. We've got our partner feedback forms. So if there's anything that you want to know or questions that you have coming in, this is a really great way to submit information to us to receive a response that will hopefully answer your questions and give you the resources that you need. We also have different resources for families. So there's obviously information online. We have FAQs and some like one-pagers kind of showing how the wait list operates that are available on our website for families. We also want to make sure that families are aware of other programs that aren't waitlisted. So this is just the ERDC program, but under DELC, we also have Preschool Promise. We have Oregon Prenatal to Kindergarten. So if those are available or in the areas where the families are at, then by all means, we want to make sure that we get families connected with those resources. And then we've got our lovely partners at 211 Info and the Early Learning Hubs, who can help families to locate different resources in their areas. Again, we definitely want to keep encouraging families to apply. One of the big reasons for that too is because at ODHS, when they submit that application in the one system, they can be evaluated for all sorts of different benefits. So even if they're put on the ERDC waitlist, maybe they can qualify for SNAP benefits that can help ease some of the financial stresses for the family in other areas, or qualify for medical benefits or other things along those lines. So I believe that was all I had. Now I have to get back so I can stop sharing my screen. Sorry about that. And then just wondering if you guys have any questions.
Hey Jennifer, just real quick for clarity, I saw the deadline for online applications. Are you treating paper applications the same way if they're dropped off at the office after hours?
Yes, they would have to be received in the office. The part about the drop boxes are a little bit because not all offices are able. I know there are some people still working overtime, so they are checking those drop boxes first thing in the morning. But we would only be able to accept the paper applications up through when the office closes. That was a great question. Thank you.
Jen, there's a question in chat about potential additional funding for ERDC.
That would be fabulous if we do get additional funding. I haven't heard anything specific about any dollar amounts coming just yet. I mean, I'm at least hopeful that maybe during the next legislative session, we'll have some funding put toward it. But essentially, we saw some of these changes were implemented in, when was it? The 2021 legislative session. And the tricky part about that is that the legislative session, like you end up setting the budget for a 2-year period, but we weren't even implementing some of these changes until, like, the non-citizen coverage, that's not until 2024. And so when the House bill actually passed, there was no funding attached to it because it was so far in the future that a lot of the changes were happening. But yeah, it would be fabulous if we could get more funding and then hopefully lift the wait list. And there is a question about Baby Promise, and Baby Promise actually is not one of the contracted slots that would bypass the reservation list. So to be eligible for Baby Promise, the child has to be eligible for ERDC first. And so essentially Baby Promise is going on a wait list as well for new applicants. And that's kind of an unfortunate way of how that's set up. And there are a lot of, we've had these bypasses to the reservation list. It actually started out with just the bypass for TANF families and ERDC families who were reapplying. And then through the years, different bypasses were added, but it gets to a point where if you allow too many families to bypass, then the wait list doesn't work at all. But there are a lot of populations that I would love to add bypasses for. Unfortunately, I think we've hit our maximum in how many populations we can identify there.
So in terms of a Baby Promise open slot, does that mean you'd be looking for like a family on TANF or a family that meets one, like if there's an open, if there's space in a Baby Promise program, we would work to get one of the other populations who's still in the mix into that slot?
Yes, either if they're new applicants or we do have a lot of families that are eligible for ERDC, but they haven't been able to find childcare in their area. And so we do have, oh goodness, I want to say it's over 3,000 families right now that aren't currently connected to a childcare provider. We're doing a little bit more data analysis on that because this is fairly new data. So the families that haven't managed to connect to a provider before July, we were closing those cases out after about 2 or 3 months. We didn't leave them open, but at this point in time, we will have cases that will be open for longer periods of time that aren't connected to a provider. So even though they're not necessarily costing money right now, they are a potential financial liability, if that makes sense, because as soon as they connect to a provider, it could start costing money. But apart from that, we really want to do a lot of analysis on these families, where they're at, how long they're on the wait list. Some of the curiosities that I have are if the families are actually using like family, friend, and neighbor providers, and they don't realize that we can cover that care. So we do have, I think it's in one of the toolkits, but we have a one-pager on family, friend, and neighbor providers and how they can become eligible. So we're really going to start sharing some of that information too. But that's one of the reasons why we really want to stress families contacting 211 info. So if families are in a Baby Promise area, then they can most definitely get those referrals over if they meet the other qualifications.
Hey, Jen, this is Tori. Can I add to that?
Yes,
Awesome.
absolutely.
Hi, Dana. I'm Tori Fire. I work with Jen. I'm a consultant from Alvarez and Marcel, who's been supporting the activation of the ERDC waitlist and all the communications around it. So we are working closely with the 3 CCRNRs who operate Baby Promise. One thing we're doing is reaching out to those CCRNRs and making sure, I believe that all of them have waitlists for Baby Promise right now. I could be wrong about that, but we're making sure all of the folks on the waitlist for Baby Promise go through the ERDC eligibility process before November 4th. So that's one thing that we're working on proactively. And then we have a couple other ideas to make sure that Baby Promise slots don't remain open, but it's a great question.
Right. Thank you guys. I think I'm out of time, so I'm passing it back over to Misha, but I'll put my contact information in the chat too if you have further questions.
Thanks. So sorry about that. I know there was a question from Mario in the chat. Maybe you can reply to them in chat. And certainly if others have questions, you can put those in chat, and Jen's here and can help get those answered for you. We have breakout sessions planned for the second portion of today's meeting. And those of you who have participated in those sessions before know that every moment is important. They never seem to be long enough, and I know it's going to feel really short today. So I will stress that after the breakout sessions, we're going to talk about more opportunities. So if you didn't have an opportunity to share what you would have liked to have shared today, there are other spaces where you can do that. So I'm throwing that out there because we're a little bit short on time there. Mackenzie, can you go ahead and pull up the PDF of the Vision into Action?
Mm-hmm.
So I'm gonna do a quick overview of Vision into Action. Just as a reminder, for those who attended our meeting last month, you had the opportunity to hear about Vision into Action from our Chief of Strategic Planning, Patty Unfred. And those who weren't here, this will be helpful for you in going into these breakout sessions. So Vision into Action is a bridge strategy for navigating our changing systems as we seek ways to transform services. It was built on self-sufficiency programs, child welfare, and agency strategic plans and initiatives, and informed by staff and community feedback over the past several years. The Equity North Star guides us as we respond to the needs of individuals, families, tribes, and communities, and dismantle systemic disparities experienced by historically marginalized groups. Our goals are to offer services that lift people out of poverty and keep them from experiencing poverty in the first place. Have policies and practices that reduce the racial wealth gap and support each person served to achieve financial stability. Offer holistic services tailored to connect people with future-focused skills, training, and education to secure stable and well-paying jobs connected to their long-term goals, and make case management, resource navigation support, and referrals accessible and equitable so people can address the barriers unique to them. We will continue our journey of improvement and growth through equity, partnership, and collaboration, while honoring lived experience and supporting a well-trained and diverse workforce. We seek to provide outstanding community service, or customer service, excuse me. We will be listening carefully to our communities, learning where our services are having a positive impact and what can be improved. We know we're on track when our communities feel hopeful about their futures and are experiencing improved access to living wages, stable and secure housing, and nourishing food. So thank you for attending today and participating in our breakout sessions. We know that historically we have not been good at following up when feedback is received. We also seek to improve on this. Our facilitators will be taking notes during the conversations and will note who is providing the feedback so that follow-up can occur. We will also provide follow-up during this meeting as we create and implement our Vision into Action guide. This guide will inform how we make Vision into Action a reality. Your feedback today will be integral in the creation and implementation of this guide. Each breakout room will have a Vision into Action workgroup member who will help facilitate the room and take notes. We will use these questions. I'm going to go ahead and copy them into chat so you can see them. I know that we're short on time. You will not be able to get through all 3 questions. So within your breakout session groups, determine which question you'd like to focus on. And if there's time to do more than 1 question, that's wonderful. So don't feel like you need to get through all 3 questions. Go ahead and just help these guide your conversation. If there is anyone who needs closed captioning or ASL interpreting, please message me directly so that we can make sure that those supports are available in your assigned breakout room. Breakout sessions are going to conclude at 2:50 so that we have 5 minutes for a quick report out on any themes that we heard during this time. And I will also share more community voice opportunities around this at that time as well, so that as I said earlier, if you didn't have time to share what you'd like to share, you can learn of the additional opportunities to do so. So at this point in time, Mackenzie, are we ready to move into breakout sessions?
Yeah, 1 second.
All right. Well, feel free to reach out to me at any point in time if there's a question throughout today's breakout session, and I hope you have some great conversations.